Respected attendees, esteemed colleagues, dear friends, at the outset, let me express my gratitude for the kind invitation to participate and address this summit. The initiative of WHO Europe is to monitor childhood obesity is implemented in our country with funding from the National Annual Program for Public Health and with technical support from WHO. And we are proud to be part of the largest childhood obesity monitoring system in the world almost since its inception. So far, 5 rounds of data collection have been conducted. North Macedonia, unfortunately, is among the countries in Europe where the prevalence of obesity among children and in adults is high. In 2010, there were 30.7% of children with increased weight, while in 2019, that percentage increased to 31.6%. It is evident that the problem cannot be solved only by measures originating from the health sector, nor only by changing the habits of the population. It is simply not fair to demand change from our citizens without providing them with opportunities to make those changes happen. The complexity of this problem emphasizes the need to consider multidimensional models that require interdisciplinary and participatory approaches to treatment. That means that we do not have the luxury of letting this health risk self-regulate, but it should include a comprehensive approach to solving the problem. I believe it is a complex task before us because the risk factors for increased body weight are deeply rooted in social patterns and modern lifestyles. We need to create a common approach through cross-sectional cooperation involving health authorities, as well as every one of us who can help raise public awareness, building a strategy and partnership between the state, parents, educational, and civil sector to promote a healthy lifestyle, healthy and moderate diet for children, by monitoring the menus in kindergartens and schools, and by monitoring the advertising on foods rich in salt, sugar, and fat. And also motivating the children to replace their dependence on phones and computers with physical activity by interventions in the educational process, changes in urban planning, and providing enough green areas and opportunities for practicing physical activity during rest or while performing their daily tasks. Only if we do this, we will build healthy generation, crucial for the sustainable future. Since 2021, I joined an initiative aimed at influencing changes in the habits of preschool children. In the previous period, we did a lot in regulating the quality of meals in kindergartens and schools, changes in the environment in kindergartens, but also increasing the awareness and knowledge of the parents and of the employees who take care of our children as well. Speaking from the perspective of a pedodontist, I may say that we are one of the first countries in the region that since 2008 has been implementing a national strategy for prevention of oral diseases in children up to 14 years of age. I would like to stress that when it comes to caries, which is the most frequent chronic disease in children, one of the most important etiological factors is the frequent and high sugar consumption, as is with increased body weight. Hence, reducing the consumption of refined sugars to less than 10% of total energy intake, and ideally even more to less than 5%, minimizes the risk of dental caries and in the same time of increased body weight throughout the life. I want to emphasize that this is important to work as early as possible. In fact, the best way is to start with young people during family planning and with pregnant women in order to start practicing a proper dietary regime and a healthy life. We are participating in a project implemented by the UNFPA and the Clinic of Gynecology by educating gynecologists, pediatricians, and expectant mothers on the prevention of such conditions by, among other things, reduction of excessive intake of refined carbohydrates, and promotion of breastfeeding. The countries and peoples of Europe are interconnected at multiple levels, regional or pan-European, which should be used as an opportunity to tackle the problem of obesity. Therefore, I believe this initiative is extremely important, and I would like to congratulate Professor Music-Milanovic and Dr. Kluge, as well as the WHO, and I would like to conclude by strongly supporting the Zagreb Declaration, and I'm looking forward to seeing you all in person soon. Thank you.